morning, madam. Good morning, my dear friends. Today I am going to deal about guidance and counseling. That is my lesson plan is diagnostic and remedial measures. So, how we have to diagnose and how we have to take the remedies in the guidance and counseling. So, in the introduction, we will be seeing all the guidance and counseling. So, whenever we want to take anything else, that means when we are coming to the M.Sc nursing course, we have taken the guidance and counseling. This is good or bad. So, how it will be? The information will be gathering the people. From the people, we will be gathering the information. In the guidance and counseling, it is a twin concept. So, guidance should be there and counseling should be there. So guidance means we are showing the way to the person. Counseling means we have to giving counseling to come out from that situation things. Like that it will be there. So have emerged an essential element of every educational activity. Guidance and counseling is not a synonymous term. Counseling is a part of guidance. So both are interlinked. Here we can see. Guidance in education context means to indicate, point out, to show the way, lead or direct. As I shown, guidance means showing the way or we are directing. So we'll be saying that here if you go means there you will be getting a path. Like that will be guidance, will be giving the guidance. So our madams also will be guiding to us. So in the research work, so much of guidance they will be giving. You have to do this one, you have to show like this way. We have to, they will be directing us to go to reach our goal. That is called the guidance. So counseling is a specialized service of guidance. It is the process of helping individual to learn more about themselves and their present possible future situation to make a sustainable contribution to the society. So like that guidance and will be there. The definition of guidance. Guidance is an assistance made available by the competent counselor to an individual of any age to help him direct his own life, develop his own point of view, make his own decisions and to carry out his own burdens. That is Himrin and Erickson. So guidance is a process of helping every individual through his own effort. So guidance is a process of helping every individual through his own effort to discover or develop his potentialities from his personal happiness and social usefulness. This is Ruth Stanger. Now we have seen the counseling definition. So counseling is essentially a process in which the counselor assists to counselee to make interpretations of fact related to choice, plan, adjustment which he need to make. That will be essential process. Counseling is essential process in that counselor assisting. The counselor will be assisting to the counselee to make interpretations of facts related to the choice, plan or adjust which he needs to make it one. Gillen and Smith. So, counseling is a series of direct contact with the individual which aims to offer him assisted changing his attitude and behavior. This is Carol Ropes. The purpose of guidance and counseling, providing the needed information and assistance, helping an individual to make with wise choice. So wise choice they have to make, helping the individual to make a wise choice. Next, improve the understanding of self. They have to improve their understanding, self-understanding, what I am, how I have to adjust. So like that. So facilitate the adjustment. Now we are seeing if we see in this corona situation, we have to adjust ourselves, the improvement of adjusting. So I have to use sanitizer, I have to make the social distance, I have to cover this. Everything we have to doing the adjusting, facilitate our adjustment like that. Helps in adopting the changes to our new environment. Same as I have taken this example of COVID-19. We will be adopting the changes. This is the new environment is there. So some people will be having some depression will be there. So that type of people we have to give the counseling and guidance we have to make. Making self-sufficient and independent. Next, efficient use of capabilities and talents. The efficient use of capabilities and talents promote optimal personal and professional development. Balanced physical, psychological, emotional, social and spiritual growth. So we have seen here, so What do you mean by health? Health is a total well-being. That is physical, mental, social, psychological, everything we have to be maintained. So here to maintain a physical balance in life means, so these are the things we have to be get. Next, helps overall development to live a productive of life. So overall development and productive of life we have to be seen. Next, guidance in promotion of health. So whereas we have seen that is a health program. This is the basic responsibility students health program rests with the health officers in charge of sudden of the student health center. That is the here if you see student health program, that is the desirable problems, particular problems is there that we have to be see here, and see we have the academic sections. So when we join academic section, we have to be see that medical checkup will be there. So with any particular problems, with any disturbances like tuberculosis, any other skin diseases, that and all we have to see the students' problems. The basic responsibility of students' health problem we are test with the health officer in charge student health center. He should set a climate of acceptance for students' problems, particularly in case of early detection or disorder like venereal diseases or tuberculosis, etc. It is desirable to have a medical checkup of all students in the beginning of academic sections. As I told, when we joined also, we will be having the medical checkup will be there. So like that, health programs will be conducted. Measures to promote preventive and environmental health. What are the measures will be taken to promote preventive and environmental health? For example, if you have take supervising the hostels, how the cleanliness is there, how environmental sanitation they are maintaining, how the everything is there. That is the hostel, everything that will be checking out. That is called the supervision. So immunization. Immunization means already we will be giving that hepatitis injections will be given, and also BCG injections that is in the birth, at the time of birth will be taking. So like that immunizations also will be given. Next, following measures may be taken for early diagnosis and treatment for illness. So if any illness is noted, so for that illness we have to take the following treatment, that is a physical examination, follow-up treatment, reference of medical resources, maintenance of confidential files of health records. In our college also will be maintaining the maintenance that is confidential files will be having. If any rehabilitations is there in any schools or like that, so rehabilitation that file will be necessary. Rehabilitation of disabled, medical measures for speech and hearing defects. So like that measures will be taken. Purpose of organizing counseling services in educational institute. Why the purpose? What is the purpose of organizing the counseling services in educational institutions? Why means to help the adolescent with normal developmental problems, to help individual through the temporary crisis, to refer cases needing special treatment, to facilitate communication within and between the schools, homes and communities. Next, setup of organization of counseling services. We will be having the setup. First, we have to what we will be seeing according to the plan. First committee will be there. According to that committee, we have to plan where we have to be set up the organization for the counseling services. So, a psychology officer assisted by guidance committee plan the program according to their needs and implement the program with the cooperation with academic advisor and deputy chief. At university, deans are assisted by HOD of psychology. Guidance committee counseling officers make plan and implement it. If students are less than 1,000, a liaison officer, liaison means in between he will be acting like that. Will look after these services. Here we have seen like that, no? Same. Next, qualities of a good counselor. G. Good technical knowledge. O. Obedient, obtaining appropriate information from the patient. O. Objectivity, answering questions. D. Demonstrating professionalism. C. Confidentiality maintenance. O. Observant. you unbiased and non-judgmental, is sensitive to need to the patient. He empathetic. L listen carefully. L less the patient make let the patient make decisions. Open-minded or respect the right of patients. Next, who are the members will be there in the counseling committee? The members of counseling committee, that is the administrator, principal or dean, counseling or liaison officer, deputy chief of a counseling section, counseling personnel or counselor, occasional guidance officer, teaching or faculty from the different departments or specialities, hostel warden, librarian, student representatives and parents. These are the committees will be there in the counseling committee. Okay, can you understand this guidance and counseling? That is the diagnostic and the remedial measure. Diagnostic means we have to give the guidance to the people that they have to understand and they have to give. Counseling, a special counselor and counselee should be there, and she has to give all these counseling services. That is the immunization, they have to give that, and hostel supervision, they has to make who are the participant, everything that I think you can understand. You are understood this one. Thank you for your attention. So what I mean to say is prevention is better than cure. That also now we are seeing also corona. That is prevention is better than cure. So all of you please try to use sanitizers, social distance and mask. So don't forget these three things in these situations. Okay, thank you ma'am and thank you everyone.